Hello, everybody, and welcome to this month's vlogcast. I've got Claire Harrison with me, who's very kindly, we were just talking about the difference between Pegasys and Besremi and an update on where we are with interferon. And welcome, Claire, and thank you very much for giving me the time this morning to talk about this. Perhaps you could give us a little recap of where we are with what happened with Pegasys and where we are now.
Well, good morning, Nona. Thank you as well for doing these vlogcasts. I think they're fantastic. Morning, everybody. So just stepping back for a moment, just reminding everyone that at the moment for MPNs, there are two types of interferon that are mainly used. One is called Pegasys, which is Pegylated interferon alpha 2A, which is an old drug that's been around for a while. And the other is Besremi, or Pegylated interferon alpha 2B. They're very, very similar. They are long-acting interferons. There are some small chemical differences between them, but there's no clear evidence that one is better than the other if you look at a group of patients. Besremi is a newer version of interferon that has been developed and most recently approved in Europe, but not approved for use in England and the UK for polycythemia vera, and recently it's been approved for essential thrombocythemia again in Europe. Pegasys has been routinely used across the UK for many years now for MPN, but a shortage arose around about a year ago. Time's passed very quickly, but I think it was about a year ago, Nona. And that was because Roche, who used to make Pegasys, decided they didn't want to make it available anymore, and they dismantled their factory. And so we had been for several years using old stocks of Pegasys, still in date, but old stocks. More recently, another company for whom we should be very grateful, called Pharma and, have rebuilt a brand new factory and made Pegasys, which has passed all the regulatory approvals. So in the gap between the stocks running lower and the new factory being available, we had the shortage. In England, we had approval from NHS England to use Besremi. And now Pegasys is more widely available. It's approved for use in the UK and specifically in England. And so stocks are now becoming available in hospitals. And we now have a situation where we have both drugs available and in circulation, but we have to think and be guided by our health authorities. And so for England, that is NHS England.
So what happens to patients on Besremi?
So the first thing to say is that patients who are on Besremi will probably have to transition to Pegasys. There are plenty of stocks of Pegasys. So I was looking recently at our stocks. For example, at Guy's Hospital, we had very low stocks of Pegasys for a long time, and we switched over 200 patients across to Besremi. This last week, we had over 200 doses in stock, so back to our normal levels. And so gradually, we will be switching those patients on Besremi back over to Pegasys. The exceptions for that and the difficulty we may have and the conversations we will need to have over the coming weeks and months are, what about the patients who do better on Besremi? And doing better would be unusual, but could be for two reasons. One, they could have better control of their blood counts. And secondly, they could potentially have less side effects. I think this affects a very small number of patients. And at the moment, we are in conversations with NHS England, asking them, can we make an exceptional policy for those patients who are doing better for whatever reason on Besremi? But at the moment, what we will be planning to do is in the next 6 months to gradually transition patients back from Besremi to Pegasys. And any new patients who are starting interferon will, for the most part, be starting on Pegasys.
I've got a question here. For a lot of people, they wonder why they have to transition off Besremi if it's working for them. And is there an answer to that?
Well, that's a really good question, Nona. And the simple answer is actually a financial one. That at the current price, the price of Besremi appears to be much higher than the price of Pegasys. So Pegasys has come back in and is available at the price it always was. And Besremi is complicated pricing wise, but appears to be more expensive. And so at the present time, we are collecting data to show how patients did on Besremi, roughly what dose they were on, and roughly the cost of that, so that we can inform a conversation about really what is the cost implication of some people staying on Besremi. But I think the most likely situation is there will be the availability of Besremi for some patients in a specific situation. Those ones I've mentioned already, probably those patients whose disease control is better or for whom side effects are better on Besremi. And there are some chemical reasons that could logically explain those two scenarios. But we, in England, will have to have that conversation armed with data. So some of those questions may well come to you, the patient community. So please do look out if we do put a survey out, and please do contribute your views and your experience. It's very, very important.
Thank you, Claire. I think that explains it. And I suppose the best thing for patients to do is to ask if they're confused by anything, is to go to their clinical teams and talk to them about it, because as time evolves, you'll have more information about this.
Absolutely. And when this all happened about a year ago, we had to move very, very quickly and move some patients between medications, change doses, space them out. Some patients had a treatment holiday, etc. And that happened very quickly. So I think the most important thing is a message of reassurance. This is a 6-month or so transition. It will not be done swiftly. There is plentiful supply of interferon. And at least in England, the situation where we have been allowed to prescribe this drug will continue. We will be allowed to prescribe a form of interferon for patients with MPN. Meanwhile, of course, there are other exciting news which we'll be hearing about later in the year about newer therapies and new data, etc. So, there's I think a lot to be positive and very grateful for. And I think we should be very, very grateful to all of the teams across the country who work very hard to use interferon as sparingly as possible, transitioning patients, and also AOP Pharma, who did make Besremi available for patients, and NHS England, who agreed to fund that, did mean that the last year, while stressful, did pass hopefully without too many hiccups.
I think that's fantastic. And I'd like to pick up on what you've said. The future is very bright. There are lots of studies and clinical trials, and science is evolving very, very quickly. But thank you, Claire. I think that's really helpful to the patient community. And, I agree with you. If you can, as a community, respond to questionnaires, it really does help in formulating the way forward. But thank you very much. And I'm sure everybody else will be really grateful for this.
You're most welcome. Have a good day, everybody. Thank you, Nona.